Hello, my name is Fritz Maurer. I'm a mental health counselor and a transformational coach. This video today is about EFT technique. I'm going to demonstrate the basic routine for tapping. This is a technique that I use with clients to help relieve distressing emotions. And so as we are here in my home office, and this is the waiting area where people come in and wait for sessions, I'm going to move over here and take an opportunity to show you the basic routine. The basic routine, we have to understand where the tapping points are to begin with. And the first one is the top of the head. It's literally right in the middle of the head. The next one is over the eyebrow, almost to the nose. There's a point right there. The next point is here on the side of the eye, not on the temple, but on that bone that on the eye socket. The next point is here underneath, basically directly underneath the pupil, again on the bone that's around the eye socket. The next point is under the nose. The next point is on the chin. And the next point is here on the collarbone, which you have, the collarbone connects with the clavicle here, but just in on the flat of that a little bit. There's a point there. And then the next point is about 4 to 5 inches under your arm, and I call it the soft rib, right there. Those are the basic tapping points. And now there's a basic routine to go through. So when working with people, you identify what the distressing emotion is, or the distressing feeling, and you want to scale that distress from a 1 to a 10. A 1 being like it's really not there, it's almost gone, and 10 being that it's very distressing. So let's just pick an emotion such as anxiety. I feel anxious. The other thing that I do with clients is identify where they feel that in their body, because it helps again to give them a reference point for feeling the relief of that anxiety. So often when I ask people, where do you experience your anxiety? People will say in their stomach, in their chest. Some will say the throat. I've even had some people say the back of their head. You want to scale that. So I'm gonna pick, let's say I'm feeling really anxious today and I feel that in my chest. I feel like this real tightness in my chest. And let's say that tightness, I'm going to scale it at a 9. It's really distressing at the moment. And so now you have a setup statement, and it's always the same. Even though I feel anxious, I deeply and completely accept myself. And we start here on the karate, they call it the karate chop point. I'm going to say it 3 times. Even though I feel anxious, I deeply and completely accept myself. Even though I feel anxious, I deeply and completely accept myself. Even though I feel anxious, I deeply and completely accept myself. And then I go to the top of the head and I use a shortened version of that setup statement. Is it feeling anxious? Feeling anxious. And I'm tapping 5 to 7 times. Breathing in between the tapping points, feeling anxious, feeling anxious, feeling anxious, feeling anxious, feeling anxious, feeling anxious. And then you come back to the karate chop point and you check in with yourself. Where is that SUD level, or your subjective unit of distress is the technical term for it. So I was at an 8 before, or a 9 I think I said. I'm actually feeling like I'm down at a 3, so my anxiety about this video has gone down. If it's come down to like a 5 or a 6, you just go through it again. Even though I still feel anxious, I deeply and completely accept myself. Even though I still feel anxious, I deeply and completely accept myself. Even though I still feel anxious, I deeply and completely accept myself. And then I'll go through the whole routine again. Top of the head, feeling anxious. And you want to get yourself down to 1, 2, even a 3, because then the feeling is manageable and is not as distressing. You can do it with both hands. Sometimes that can help people if you're especially having trouble concentrating while you're doing this. You could do it on both. So that's the basic routine. It works wonders for people. I have seen people just literally melt on the couch in my office and describe it as very relieving. This is the basic routine for tapping, and I'm hoping it's going to be helpful for you. Keep doing it. It works.